Thank you. I'm humbled to be here today, and I've been asked to maybe, let's call it, to do the warm-up for the startup pitches, and I think we're probably in the later stage of startups. And what I wanted to talk with you today is really not so much about Aidoc, but maybe about what makes an Israel entrepreneur go the journey of an Israel entrepreneur through the thick of the US healthcare ecosystem. So this is a bit about me, or maybe me 7 years ago. Basically, my experience prior to Aidoc was in the Ministry of Defense. As a lot of the entrepreneurs here you'll see, I was part of a program called Talpiot, and I led AI for the Israeli Air Force for multiple years before starting Aidoc. $250 million in funding later, and today we're considered the leading platform for clinical AI in the US. We have the most FDA clearances in the world for clinical AI. We're live at about 150 health systems, including some of the amazing people I saw here in the crowd, like UHealth or Memorial. I'm very proud to be partnered with those. But more importantly, we recently broke the threshold of analyzing 100,000 patients daily. Thank you. And for each of those patients and the diseases that we cover, we're virtually eliminating missed or delayed diagnosis. So one could ask, what the hell is this guy who just got out of the army, knows nothing about business, nothing about healthcare, and for sure, nothing about the US healthcare, has any business leading one of the leading companies in the world in clinical AI? So I want to cover 3 operating principles for Israel entrepreneurs. The first is that we have a pretty deep sense of purpose. Maybe it's the military, maybe it's how we grew up and like the fact we're always in constant threat, so we know how to focus on life. But you'll find Israel entrepreneurs are really, really driven. And I don't have any other explanation of why there's so many Israel entrepreneurs into healthcare. There shouldn't be a logical reason. And for Aidoc, our purpose is really this prevention of adverse care gaps or preventable disease. And I'm sure the people here know because we're all passionate about the same things, but today we have a shortage of 65,000 physicians across the US. That leads to all of this downstream effects, the misdiagnosis and delays, and people don't get the treatment on time, and we've all been through it or know someone who's been through it. It was hard for me to capture the full significance until Hopkins published a study last year that estimated every year in the US alone, we have 400,000 deaths due to misdiagnosis. That is the 3rd largest cause of death of any kind, right, including car accidents. Number 1 is cardiovascular events. Number 2, oncology. Number 3, preventable misdiagnosis. And that's why we're here. So deep sense of purpose. The second thing is that many Israelis may not be the best at science, but they're really good at solving problems. There are some Israelis that are also really good at science. But many of us are really good at solving practical problems. And I remember from my Air Force, I've worked a lot with academia and AI professors, and they all get up in the morning and got me like, oh, I have this amazing new algorithm, and it's gonna change the world. But hey, if I can't integrate that and make it operational, it's not gonna create an impact. In fact, I remember in the first month of starting Aidoc, we had a conversation with a very famous neuroradiologist. And we showed him a demo of how Aidoc would look like. And we showed him the AI and the algorithm and how it would help him really, prevent errors or delays. And he told me, guys, this looks nice, but you have to understand, I'm too busy. I don't have mental real estate, and I can't allow myself to have more button clicks. And your program here has 3 or 4 button clicks that requires me to get your AI insights. So then we told him, okay, fine. So we'll build a new product that in one button click, you'll get all the results. So he told us, guys, you're not listening to me. 0 button clicks is what I'm willing to give you. But that are the types of challenges that we Israelis like. We like to solve workflow problems like this. And of course, we have. Last but not least, I would say we like, to think big. And I'll be remiss as an Israeli if I wouldn't talk about the chutzpah. Some may call it chutzpah, some may call it confidence, some may call it complete lack of self-awareness, but that is what we were good at. And when we started Aidoc, really, we had this workflow, we had this mock-up, but we didn't understand why isn't adoption skyrocketing? Like, we're solving a big problem, we're integrating the workflow, like, what's wrong? And when we saw the world and we looked at the different solutions out there, we saw that the problem was massive fragmentation. Building an AI solution into the workflow is so tough that you had a whole company solving one disease. You had the company for brain bleeds, which was us at the beginning. You had the whole company for lung cancer. You had a whole company for whatever, stroke. And those are things very hard to adopt. Think about you as a user. Would you use any software instead of a spell checker? Imagine if you had the spell checker for A words and the spell checker for fruits. I mean, that's not really usable. So we basically said, which was very hard to do as entrepreneurs, we want to fix it and build a comprehensive platform. We understand that the whole market goes one by one, but we will build something that is so comprehensive that it will basically going to solve the problem as a whole. And indeed, I would say I'm kind of running ahead, indeed, $250 million in funding later, 300 engineers working day and night for 7 years, dozens of clinicians validating and publishing results. And we basically built this platform, which is Aidoc today. To be clear, we still have a lot to build. But today, we have this platform with 30 use cases, many health solutions, many health systems that are using it. And I prepared this text I just got because, again, it all comes back to the purpose for me. So this is a text I just recently got that I wanted to read. Hey, Elad. It's from a physician from one health system we just went live in the West Coast. I just wanted to know that we are not officially live yet, but Aidoc is already identifying things that were missed. One of your team members today alerted me about a pulmonary embolism, which those of you don't know is a critical disease, that the system picked up. I checked the reading, and it was read as negative. Thanks to Aidoc and your team, the report was addended, and the patient will be treated. Thanks for the collaboration. And that is what we're really all about, right? So you're going to hear some pitches from amazing entrepreneurs. And basically, I wanted to say I am humbled to be part of this community. First of all, part of this room of people that have a burning passion to change healthcare, and the US healthcare specifically. But also humbled to be part of this community of Israeli entrepreneurs that have the big sense of purpose, the practicality, and let's call it the complete lack of self-awareness to tackle these big problems. So thank you.